The study was a multicentric randomized phase 3 placebo-controlled study which was done in patients with the locally advanced relapsed cervical cancer. And in this study there were two objectives. The first one was to assess the role of a combination chemotherapy, not including cisplatin but another chemotherapeutic agents. And the second objective was to assess the role of bevacizumab in combination with chemotherapy to see whether by adding an anti-angiogenic compound it would be possible to increase the survival of those patients. And clearly the endpoint, the main endpoint of the study was an improvement of the overall survival. And this is a particularly relevant question because in the last 10 years there have been a plateau of the results achieved in this particular patient's overall survival of about 12 months. And the data which were presented focused only on the comparison between adding bevacizumab to combination chemotherapy. What was really relevant is that in this study it was shown that by adding bevacizumab to the standard combination, which is today cisplatin and paclitaxel, it's possible to increase the overall survival by a period of 4 months. And that's a relevant result because also it's in agreement with an increase of the overall response rate as well as an increase of the progression-free survival. And what is also relevant is that the toxicity was acceptable in this treatment and there was some anti-tumor effect also in the field of radiation, which is very difficult site of getting results. The majority of those patients with locally advanced disease, they had already failed a previous radiotherapy and perhaps a platinum as radiosensitizer, and there are no options for them. And therefore, to have an increase of the overall survival, it's really meaningful. It's a bit too early to bring already directly these results into clinical practice. The first point is that even though the study had very positive aspects like randomization, stratification factor, lack of crossover. There wasn't a cost-benefit analysis done. There are still the translational results to be presented, which might be useful in selecting the patients who are really suitable for the treatment. And also the point is that there were many fears as regards the potential toxicity of this combination because patients who had the previous radiation, very often they have adhesion in the pelvis, or there are some loops of the bowel within the recurrence, or there could be some involvement of the bladder and the rectum. So they could be very susceptible to some perforation, which was one of the major fears. And actually the incidence of adverse events clearly related to bevacizumab was limited, possibly because the patients were selected carefully. So one really an important advice is that to give this kind of treatment, the patient should be very well selected, and it should be clear which could be the risk factors for toxicity. I think the results are very good, and they also confirm some already available results which show that bevacizumab single agent is effective, and there are already some good anti-tumor activity of the combination of bevacizumab with paclitaxel.